Are you a man, or do you know someone, who wakes up several times at night needing to urinate, has trouble fully emptying the bladder, or notices a bit of leakage afterward? If that sounds familiar, this video is meant for you. We'll go over medications that may help ease these symptoms while keeping side effects to a minimum. I'm Rena, a urologist and pelvic surgeon, and today we're discussing treatment options for benign prostatic hyperplasia, often called BPH. BPH simply means the prostate gland has grown larger than normal. The prostate is a small, walnut-sized organ located just below the bladder in men. As it enlarges, it can press against the urethra, the tube that carries urine out of the body. This pressure can lead to symptoms like frequent trips to the bathroom during the day, a sudden and urgent need to go, a weak or interrupted urine stream, difficulty starting, and that lingering feeling that the bladder hasn't completely emptied. If you or someone you care about is dealing with these symptoms, you're certainly not alone. About half of men over 50 and nearly 90% of men over 80 experience prostate enlargement. Many of them eventually need treatment. So what are your options? There are several approaches I've talked about before on this channel, but one of the most common first steps is medication known as alpha blockers. These drugs work by relaxing the muscles in the prostate and bladder, helping urine pass more easily through the urethra and reducing the effort needed to urinate. Here's something important to know. Often, you'll visit a urologist, be prescribed a medication, and be on your way. But did you realize there are actually 6 different types of alpha blockers? So how do you know which one might be the best fit for you? To answer that, researchers conducted a large network meta-analysis, a type of study that pools data from many clinical trials to compare multiple treatments at once. In this case, they analyzed 22 randomized controlled trials involving around 3,000 men with BPH. Participants either received one of the medications or a placebo to measure effectiveness. Why are there different types in the first place? It comes down to alpha receptors, the targets these medications act on. These receptors have several subtypes. Some are found mainly in the prostate and bladder, while others are located in blood vessels. Each medication works on different subtypes, which explains the variations in how they perform. So, what are the commonly used options? 2 of the most frequently prescribed are silodosin and tamsulosin. These medications are highly selective for alpha-1A receptors in the prostate and alpha-1D receptors in the bladder, making them what we call uroselective. That means these medications are quite targeted toward urinary symptoms. Another option is a drug called naftapidil. This medication is currently available only in Japan, so for viewers there, it may be especially relevant. It is highly selective for the alpha-1A receptor, with a stronger binding affinity, which may make it particularly helpful for prostate-related symptoms. Other medications in this group are less selective. Because they also act on additional receptor types, including those in blood vessels, they can sometimes lead to more cardiovascular-related effects. These include drugs like alfuzosin, doxazosin, and terazosin. In the study, all 6 of these medications were compared across several important measures. One key outcome was the symptom score, known as the International Prostate Symptom Score, IPSS, which evaluates how severe symptoms are and how much they impact daily life. Researchers also looked at post-void residual volume, or PVR, which measures how much urine remains in the bladder after urination. Another factor was urine flow rate, called Qmax, which tracks how quickly urine flows out, measured in milliliters per second. Finally, they monitored treatment-emergent adverse events, in other words, side effects. So, what were the results? When it came to reducing symptom scores the most, meaning overall improvement, tamsulosin at a dose of 0.4 milligrams came out on top. It's worth noting they did not evaluate the higher 0.8 milligram dose. Following tamsulosin were naftapidil and then silodosin. Tamsulosin also showed the strongest likelihood of improving post-void residual volume, again followed by naftapidil and doxazosin. When it came to urine flow rate, tamsulosin performed the best, with terazosin next, and then silodosin. At the end of the day, quality of life is what matters most, but the best medication really depends on your specific symptoms. For example, If a weak or slow urine stream is your main concern and tamsulosin isn't helping, terazosin might be a better fit. If the main issue is not fully emptying your bladder, and that's been confirmed during a urology visit, then doxazosin could be worth considering if tamsulosin isn't effective. These are important details not just for healthcare providers, but for you as well. So you can speak up and say, "This medication isn't working for me. Could we try a different option?" Now, let's talk about side effects. These medications can sometimes cause dizziness, low blood pressure, fainting, or even falls. Some people may experience shortness of breath or what's called orthostatic hypotension, when your blood pressure drops as you stand up from sitting. Other possible side effects include headaches, retrograde ejaculation, where semen enters the bladder instead of exiting the body, and a condition known as floppy iris syndrome. Now, floppy iris syndrome is something you mainly need to think about if you're planning to have eye surgery. Your ophthalmologist may not be too happy if you've been taking one of these medications, because they can affect the iris and make the procedure more challenging. So what about special situations? For example, I often see older patients who are at risk of falls, or individuals who are particularly concerned about changes in ejaculation. What should you consider in those cases? If minimizing retrograde ejaculation is important to you, alfuzosin appears to have the lowest risk. Only about 0.6% of men report issues with ejaculation on this medication, generally less than 2%. In comparison, silodosin has a much higher rate, close to 20%. If you also have high blood pressure and want a medication that can help with both blood pressure and BPH, terazosin and doxazosin can serve that dual purpose. Now, when we look at studies reporting side effects, it's important to understand that many are funded by pharmaceutical companies. Because of that, I looked at a study using data from the FDA Adverse Event Reporting System, which collects real-world reports of side effects, along with the Medical Expenditure Panel Survey, which tracks how many people are taking specific medications. This study analyzed data over 7 years to get a clearer picture of actual side effects. What they found was that doxazosin had the highest overall rate of side effects, followed by alfuzosin, then prazosin, which we haven't discussed yet but is another similar medication, followed by tamsulosin, and lastly, terazosin. The last three, prazosin, tamsulosin, and terazosin, had fairly similar and generally lower rates of side effects compared to alfuzosin and doxazosin. Looking more closely, alfuzosin was associated with a higher rate of falls. When it came to low blood pressure, both doxazosin and alfuzosin showed higher rates, along with more reports of dizziness, fainting, shortness of breath, and headaches. Among all of them, doxazosin had the highest rates of these issues. One key thing to keep in mind is that dizziness and falls become more common as people get older, but this becomes especially important in men with BPH. Why? Because many are already waking up multiple times at night to use the bathroom. That alone increases the risk of falling. Then, if you add a medication that may cause dizziness when standing, the risk can increase even further. So, if you're dealing with orthostatic hypotension, meaning you feel lightheaded when standing up, it's worth discussing with your doctor whether a more selective medication might be a better fit. Options like tamsulosin or silodosin tend to be more targeted and may lower the risk of that drop in blood pressure. Now, what if you also have erectile dysfunction? Before choosing a specific alpha blocker, you might want to think about a daily dose of tadalafil. Tadalafil, also known as Cialis, is commonly used for erectile dysfunction, but it has also been shown to help men with an enlarged prostate. So instead of taking 2 separate medications, you could take a single daily dose of 5 milligrams to support both erectile function and BPH symptoms. That said, if your current erectile dysfunction treatment is already working well and you'd rather not change it, adding a different medication could make more sense. In that case, one drug that showed a slight improvement in erectile function is naftalpidil. Unfortunately, it's not available in the United States, but studies suggest it may help men with BPH in this area. The reason may be its slightly different way of working. It appears to target alpha receptors in a more selective way, which could have a more favorable effect on blood vessels. By relaxing blood flow to the penis, it may support better erections. In theory, All of these medications could have a similar effect, but this particular benefit was observed in a smaller study. Another interesting piece of research looked at factors like cholesterol, blood sugar, and blood pressure. The question was whether certain alpha blockers might offer added benefits for these conditions. In that small study of about 60 men starting alpha blockers, researchers found that both systolic and diastolic blood pressure, the top and bottom numbers, along with total cholesterol, LDL cholesterol, and hemoglobin A1C levels, which reflect average blood sugar over the past 3 months, were significantly reduced in the doxazosin group. These improvements were seen both compared to baseline and when compared to men taking tamsulosin. While the study size was limited, it does suggest that doxazosin could be worth considering for individuals who have these additional health concerns and tolerate the medication well. So, what's the bottom line? If you have BPH and are thinking about medication, tamsulosin at 0.4 milligrams and possibly even 0.8 milligrams, though more data would be helpful, appears to be a strong option. It not only improves symptoms effectively, but also tends to have a relatively low rate of side effects, making it well tolerated for many people. That said, the best choice can vary depending on your specific concerns. If you're dealing with issues like reduced ejaculate volume, blood pressure changes, or dizziness, certain medications may suit you better than others. In those situations, it's helpful to review your options and work with your doctor to find the right fit. If you found this information helpful and haven't subscribed yet, I'd really encourage you to do so. It's completely free and helps support the channel, so this kind of education can reach more people who truly need it. Thank you so much for being here, and as always, take good care of yourself, because you matter.